impact. So let's get into the details of this a little bit more. Stress urinary incontinence is going to affect over 50% of female athletes, with Paris women being at very high risk. Now, it's known that increasing the intra-abdominal pressure with high impact activities like running is going to exceed the urethral resistance, resulting in stress urinary incontinence. Now, unfortunately, these cure rates are quite low, not very good, because stress urinary incontinence in Paris runners is not really known some of their biomechanical changes during running. So we really want to investigate that. And that's what some of the new research is looking at. The new research, especially that's coming out of the Journal of Women's and Pelvic Health Physical Therapy, shows Paris runners with stress urinary incontinence have longer ground contact times and lower cadences. And I want to highlight that on this chart here. Now, the reasons for this can really be multifactorial. This can be from mitigating impact and rapid increases in intra-abdominal pressure, and this is partially driven potentially from things learned during pregnancy to increase stability and lower fall risk. And as you can see, these cadences were on the lower side. Cadence at 165. Now, this obviously has a little bit of a standard deviation here. However, 165 is on the lower end. And then also a longer ground contact time of 246. We see ranges there, which you're welcome to look at in running references, but these are going to be definitely longer contact times. All that's going to put more pressure on the pelvic floor, and it's going to put more pressure and risk for stress urinary incontinence. So those longer cadences and longer ground contact times is going to have an increased risk for stress urinary incontinence. However, it's important to note on this chart that the vertical oscillation did not actually present a significant correlation to stress urinary incontinence. What they found was that the vertical oscillation was in the mean or averages. However, we would think that more vertical oscillation would create more impact and create more stress urinary incontinence symptoms. However, they didn't see that. Also, it's really important to take a moment here and talk about the fact that collecting metrics such as ground contact times and vertical oscillation sometimes can get clinicians concerned because of time investment or potentially using expensive gait analysis equipment, or maybe just not having a setup to do a running gait analysis. But not to worry, similar to when we talked about the common styles of running, new research has shown that commercially available products such as Garmin running watches can track these parameters quite effectively. So we can see that these are being used, and they've actually been used for quite some time, and we do see more and more research validating that, which is great. But it gives busy clinicians an opportunity to be able to get a better glimpse of the way patients are running without going through a running gait analysis. They can really just have them pull up their Garmin watch, running watch, and be able to interpret some of that data. If you want to learn more about applying, interpreting, finding the normative values, check out Runner Resources. You'll have to be part of the Running Specialist Report subscription to be able to access that, but you'll find average values, gait parameters, and you can download it for quick reference in the clinic. Now, one last thing here. Paris female runners with stress urinary incontinence, evidence does support gait retraining. And this is very much emerging evidence because in combination with pelvic PT, treatment of pelvic floor, abdominal, and hip strengthening, which we know to be effective, we also see that new research is supporting gait retraining to decrease sound intensity during foot strike. That was most effective, and what they are hypothesizing is that's because it's going to decrease the impact and improve stress urinary incontinence symptoms. So let's